Good morning, everyone. This is Lynn Schrader with KHI, and thanks for joining us this morning for our UnitedHealthOne webinar on their new products that they're bringing in back, I'll say, into the marketplace. You were here a couple years ago, and so we missed you. I'm glad you're back. So I'm pleased to introduce Melody Selesky. Melody is our account manager for KHI here in Iowa, and Melody is out of Wisconsin. I bet she's a Packer fan because I think you said, Melody, you're from Green Bay.
That's right. Got to be.
Okay, all right. Well, listen, let's go ahead. I'll turn it over to Melody. She's going to go through the plans, and we've got a great agenda. It will take probably about 45 minutes, and then we will open it up for questions at the end. And if you think of them in the meantime, while she's talking, just type them into the question box, and then we'll get to those at the end. So, Melody, I'll go ahead and turn it over to you. Thanks.
Perfect. Thank you, Lynn. Well, welcome everybody to the UnitedHealthcare 2016 ACA Health Insurance Plan webinar. November 1st marks the beginning of open enrollment for the 2016 plan year. Individuals and families who will need assistance from brokers like yourself as they shop for a health plan that fits their family's needs. Today we're going to talk about the 2016 ACA on and off exchange health plans, including state availability, information for you to help prepare for open enrollment, and also our new e-store enhancements that make the enrollment process easier for both you and your clients. So again, Lynn had stated it'll be about 40 minutes. Let's hold our questions till the end, and we'll go forward from there. So some of our topics today that we're going to discuss is the state plan on and off exchange. Again, as far as some changes with both our medical and pharmacy related expenses. We'll also highlight the many value-added benefits included in the ACA plans for on-exchange, and some processes have been made to make the plan activation and billing easier for your clients. So we'll take a few minutes outlining the changes so you can see the ease of the new processes. We will then also outline the important information regarding your certification, which I hope everybody has already completed. And then we'll wrap up by showing you the recent changes in eStore, where you can assist your clients with the ease through the quoting and enrollment process. So let's go ahead and start some general review of the ACA guidelines. I'm sure most of you know that open enrollment starts on Sunday, November 1st, and is scheduled to end on January 31st. You can begin quoting the ACA plans on November 1st, and then also start submitting applications on that date. However, the first available effective date will be January 1, 2016. This year, UnitedHealthcare is expected to market on and off exchange individual plans in 35 states. This map indicates the states where we have filed ACA plans for participation on and off the exchange. The dark blue states signify states where we plan to market UnitedHealthcare plans on exchange, and our UnitedHealthcare life insurance off exchange. Orange represents the UnitedHealthcare plans that we intend to offer only off exchange, and the lighter blue are the states that represent only on exchange products. Mirrored off exchange plans are also available in states where on exchange plans are marketed and can be available to your clients via direct enrollment. In this presentation, off exchange plans will refer to the UnitedHealthcare life insurance plan portfolio that you can market to your clients on eStore. There are up to 3 different metallic level plans that are offered in 2016. The bronze plan is the least expensive plan option because it has the lowest actuarial value and greatest cost sharing. A bronze plan may be a good fit for the client that rarely uses medical services. The next levels are silver and gold. Silver for those who want to balance monthly premium cost with out-of-pocket expenses. Gold has the highest actuarial value and the lowest overall out-of-pocket for policyholders. A catastrophic plan is also available in some states for consumers who are under the age of 30, or for those individuals who are unable to purchase an affordable metallic plan level in the exchange. Out-of-pocket savings are available to your client who qualify and who are enrolled in an on-exchange silver plan for that cost share reduction plan. All on and off exchange ACA health plans must provide coverage for the 10 categories of essential health benefits defined by each state. the fact that a benefit is considered an essential health benefit doesn't mean that it is covered 100%. It simply means that this coverage has to be included in the plans. The states do define the specific details of what must be covered in each of the 10 categories of the essential health benefits. So because of this, coverage details can vary by state to state. Now let's look at the plan availability for the 2016 off-exchange products. We'll show you the counties in both Iowa and Nebraska where we're expecting to market the health plans, and then review the available plans, coverage, and network details. So for off-exchange, both in Iowa and Nebraska, we will be statewide. Off-exchange, the health plans are marketed under the UnitedHealthcare Life Insurance License, or we abbreviate it to UCLIC. The marketplace plans on the exchange are filed under the license of UnitedHealthcare of the Midlands. Marketplace exchanges are set up by each state. Iowa and Nebraska are both FFM, or federally facilitated states. So the FFM states are approved, regulated, and mandated by the federal government. The 3 plan types that are available for our 2016 health plans include the Copay Select, which will provide your clients the convenience of set copays for doctor visits and prescriptions. Our HSA 100 plans will include the option of a tax advantage health savings account for your clients who want greater control over their healthcare spending. And then our Select Saver, and again, the Select Saver, consider the catastrophic plans under ACA, are available for your insureds who are under the age of 30 or those who cannot afford obtain the affordable coverage on the exchange. All of these plans do include the pediatric dental and vision, which is subject to the plan deductible and coinsurance. So here's a quick look at the different plan grids for our 2016 products. The products do differ by state, so I'm going to go over both states. So for Iowa, our plan bronze copay plans include the Bronze Copay Select 1 and the Bronze Copay Select 2. Each plan has a set benefit amount, so the benefits may vary by the deductible amount, the coinsurance, copay, and prescription drug benefits. So you'll notice for the Bronze Copay Select 1, the office visit copay is limited to 2 doctor office visits per year per covered person on the plan. Once the office visit copays are exhausted, the future visits are subject to the plan deductible and coinsurance. There are 3 silver copay plans, our Silver Copay Select 1, Copay Select 2, and Copay Select 3. And again, these plans will vary by calendar year deductible, doctor office visits, and prescription copays. The ACA plan portfolio also includes a Gold Copay Select plan. The Gold Metallic Level Copay plan provides your client with a $1,000 per person calendar year deductible and an 80% coinsurance for medical services once the deductible is satisfied. Your client will want to choose the plan that fits best for their needs and their budget. And then there is also 2 HSA products for Iowa, the Bronze HSA 100 and the Silver HSA 100. Both plans have 100% coinsurance paid by the plan after the per person calendar deductible has been met by the insured. The HSA for our plans, the deductible is embedded. So once you have a family, the individual family member could meet their deductible and would be satisfied 100% for the remainder of the calendar year. And then the remaining family will track towards the out-of-pocket maximum for that family. The differences between the 2 plans are, of course, the plan deductible and the out-of-pocket maximums. The Bronze HSA 100 has a higher deductible and an out-of-pocket maximum than the Silver HSA 100. So because of that, it has greater cost sharing for your client. It will have a lower premium than the Silver. And here's a quick look at the Nebraska plans. So they are similar, Copay Select 1, Copay Select 2, and then our Bronze HSA 100. And again, the benefits do change by deductible and coinsurance on those plans. And then there are 4 silver plans for Nebraska, the copay select 1, 2, and 3, and the silver HSA 100. And again, those will change by deductible and coinsurance. And then also for Nebraska, we have a gold copay plan. And again, that's $1,000 deductible, 80% plan. Both Iowa and Nebraska has the catastrophic plan for anybody under age 30, and for those who get the exemption from the government, the per person deductible is $6,850. Family deductible is $13,700. Your client has a $35 copay each time he or she visits the primary care physician. The catastrophic plan can provide the greatest premium savings for eligible clients. In-network preventive care on all 2016 health plans is available to your client with no waiting period, no deductible, no coinsurance, no copays. Services that are covered are in accordance to the Affordable Care Act, and those are some of the covered expenses that are covered: immunizations, routine physicals, health screenings, cancer screenings, women's preventive, and prenatal care. Also, Tier 1 contraceptives are considered under the preventive care benefit and payable at 100% of the covered amount. So now let's take a look at the on-exchange products in Iowa and Nebraska. We'll first show where we plan on marketing these health plans, and then review the availability of the plans and coverage details. So in the states of Iowa and Nebraska, you'll notice the different shaded areas. So in the state of Nebraska, we are statewide on exchange. In the state of Iowa, only the highlighted orange counties are where we'll be on exchange for 2016. So there are some areas that we will not be on exchange. There are 10 different standard plan variations in our 2016 Iowa healthcare plan portfolio. Your client will have access to choose the plan that meets their family needs and budget. The plan types that are available, again, are the metallic levels: bronze, silver, and gold. A bronze plan will be less expensive plan because it has the lowest actuarial value and the greatest cost sharing. And the next level is silver and gold. Gold will have the highest actuarial value in the plan portfolio. And then there are 15 different cost share reduction plans available for additional out-of-pocket savings to your clients who qualify and are rolled on an on-exchange silver plan. So in going over the different plans, there are 8 standard and 12 cost share reduction copay plans that are offered in Iowa on exchange. So we have the bronze 6,500, the silver plans, 3 gold plans. Today we're going to focus our attention on the standard plans when we're viewing the plan grids. However, there are the cost share reduction plans that are available to quote on eStore. A cost share reduction plan key guide is shown to the right of this plan page. The standard plans followed by either the E, D, or C will represent the cost share reduction plan. E will equal 73% of the actuarial value. D equals 87% of actuarial value, and then the C is 94%. There are 2 standard and 3 cost share reduction HSA plans for our Iowa portfolio. HSA plans, again, can be a great fit for your client who want to benefit from the tax advantage health savings account that is included with the coverage. So let's focus on the on-exchange copay plans for Iowa. Of the standard copay plans in the portfolio, the bronze 6,500 plan will have the greatest cost sharing and will have the lowest premium cost for your clients. Each plan, again, is set by calendar year deductible, doctor office copays, prescription drug benefits, and out-of-pocket maximums. One thing that I do want to note is on some of the plan grids that you will see the lab and imaging and outpatient surgical benefit that is listed applies to services received at a freestanding facility. Lab and X-ray services received in a hospital setting may actually be paid at a lower benefit, and that would be detailed in your actual plan brochure. It is a benefit to go to those freestanding facilities because they normally charge a lesser fee for, say, an MRI or CAT scans than what a hospital does. So we definitely want clients to start using those freestanding facilities for those types of services. You'll also notice that there is a $500 per occurrence deductible, or POD, which is plan occurrence deductible, for emergency room services. Covered expenses incurred from the emergency room visit will be applied to the per occurrence deductible. Then remaining covered expenses will be paid at the plan's coinsurance level once the calendar year deductible has been met. There are 4 different silver copay plans for Iowa. And again, in the plan grid comparison, you'll see the differences between the calendar year deductible, coinsurance levels, doctor visits, prescription benefits, and out-of-pocket maximums. The Silver 2000 and the Silver 2001 will have similar benefits. However, the Silver 2001 plan has a lower out-of-pocket expense and pays 100% coinsurance once the calendar year deductible is satisfied. Although this plan has a lower out-of-pocket expense and greater coinsurance for the client must meet the plan deductible before doctor visits and prescription copays are covered. For the state of Iowa, your client can also choose from 3 gold copay plans, the Gold 0, Gold 500, and Gold 1000. All 3 gold copay plans have the same out-of-pocket expense, but the Gold 0 has no deductible before covered medical expenses are payable by the plan. The Gold 500 has a $500 per person calendar year deductible, and the Gold, of course, 1000 has a $1,000 per person calendar year deductible. Although the Gold 500 and Gold 1000 plans have a plan deductible before expenses are paid, both plans pay a higher percentage of coinsurance than the Gold 0. So again, these plans differ by deductible, coinsurance, prescription copays, drug deductibles, and out-of-pocket maximums. And keep in mind, again, it also makes a difference where lab and X-ray and outpatient surgery expenses are received. The services received in that freestanding facility will be paid at a better benefit than an actual hospital setting. The Iowa Bronze and Silver plans, we have the Bronze HSA, the 2 HSA plans, HSA 5500 and the Silver HSA 3000. And again, these are embedded deductibles, so if there is a family and one person meets their individual deductible, they would be covered 100%, while the remaining family members will track towards the family max out-of-pocket maximum. The on-exchange HSA plans, your clients will not be required to submit prescription details for processing. So on exchange, they simply purchase their prescriptions at a participating pharmacy, and that will automatically be tracked towards the plan year deductible and out-of-pocket maximum. For the state of Nebraska, there are 8 different standard plans and 12 different cost share reduction plans, and again in the same metallic level, bronze, silver, and gold. There are 7 standard and 12 cost share reduction plans, again the same bronze, silver, and gold with the same actuarial value for the silver cost share reduction plans. And then there are 2 HSA plans available, again the 5500 and the 3000, with 3 additional cost share reduction plans available. So we'll just focus real quick on the Nebraska on exchange plans. Most of them are similar to the Iowa. So the bronze, again, will be our copay plan. And you'll notice different coinsurance levels on these as well. Our 3 silver plans, $2,000, $3,500, and $4,500. And one difference to note is the Silver 1 copay plan. The out-of-pocket, actually it's not shown on this one, the 2000-1, that was like on the other one, so I apologize, that's not on here. The gold plan, there's only 2 gold plans, so we have the gold 0 and the gold 5,000. So unlike Iowa, we don't have the $1,000 gold plan here, so just the 2 gold plans. And again, different deductibles and coinsurance levels on these 2 plans. And then again, keep in mind the lab and imaging at a freestanding facility will be paid at a better benefit than at a hospital. And we also have the 2 HSA plans in Nebraska as well. On all on-exchange ACA plans, the in-network pediatric and dental is a covered service and payable at the plan's coinsurance percentage after the plan deductible has been satisfied. So you'll see the different plans and the copays. And again, this will be outlined in your plan brochure. And again, just to recap the in-network, if they go in-network, the benefits that are available, no waiting period, deductibles, or coinsurance for the covered services that are mandated by the Affordable Care Act. When your client purchases one of the on or off exchange qualified HSA plans, he or she may set up a tax advantage savings account. The money that is deposited into that savings account within legal limits can be used to pay for qualified medical expenses that may or may not be covered by the health plan. For example, dental care, orthodontics, vision, durable medical equipment, and to reimburse covered plan benefits that were applied towards the health plan deductible. So for 2016, a single person can deposit up to $3,350 into their HSA. Clients with the family plans with 2 or more individuals on that plan can deposit up to $6,750, and individuals age 55 and over can take advantage of the catch-up provision. An additional $1,000 can be deposited annually into that. Deposits to the HSA can be made at any time, subject to the IRS rules. Consumers can consider using Optum Bank as their HSA administrator. Optum Bank provides added value benefits because it is a member of FDIC. It has more than 1.5 million HSA accounts. The online banking tool also allows for easy account management. With a prepaid debit card, also your client can withdraw funds when paying for their qualified medical expenses. Your client will have the easy access of account and online banking tools, and also they can access www.hsacenter.com for more information regarding savings accounts. Now that we've reviewed the plan benefits, let's go ahead and talk about the network and pharmacy information for your clients' ACA plans. The off-exchange ACA health plans in Iowa and Nebraska will have the UnitedHealthcare Choice Plus network. UnitedHealthcare Choice Plus is an open access network, which means your clients will have the freedom to choose from any network healthcare professional in or outside of Iowa and Nebraska. The off-exchange clients can utilize non-network providers. However, non-emergency services to non-network providers will be reduced. Primary care physicians and referrals are not required. So this is a huge advantage with our products in these 2 states with our off-exchange network with Choice Plus. The penalty for going out of network, a 25% out-of-network penalty will apply to services rendered by out-of-network providers. An additional deductible amount equal to the per person calendar year deductible applies to out-of-network covered expenses before out-of-network expenses are paid. In-network covered expenses will be credited to both the in and out-of-network deductibles. Out-of-network covered amounts are credited to the out-of-network deductible only. And there is no penalty maximum for out-of-network services. The on-exchange health plans will have a different network, and that is going to be the Compass network. The Compass network limits your client's providers to his or her coverage area by state and county. For example, providers outside of the state and providers in non-participating counties will be considered outside of the service area. Plan benefits with the Compass network are for in-network providers only, except for emergency care. Referrals are required from your client's primary care physician prior to seeking a specialist. If your client sees a network specialist without a referral, a referral from his or her primary physician, benefits will not be paid. Members do not need to get a referral to see an OBGYN. So again, for the on-exchange product, it's the Compass network, in-network benefits only, except for emergency care. And they will have to list a primary care physician and get referrals to see specialists. Certain covered expenses may also be provided through our W500 network. The W500 logo is located on the back of the client's ID card. Your clients will be eligible for network benefits when certain services are received from providers who are not contracted with us through the W500. So these services would include emergency outpatient, inpatient hospital when your client is admitted to the hospital on an unscheduled emergency basis, urgent care, and other covered services that are not available from the client's network provider. Before your client receives these covered health services, a client network physician must notify us. Once we confirm the covered health services are not available from the plan network, we will work with your client and his or her Compass physician to coordinate these covered health services through the W500 network provider. Your clients also want to have information about the drugs and pharmacies that are covered under the plan. Both Iowa and Nebraska for on and off exchange will include the 4-tier essential prescription drug listing, or PDL. Covered drugs will be listed on the PDL. Drugs that are not found on the PDL listing will not be covered. If a member needs a drug not found on the prescription drug list, he or she can seek approval to have it covered. If an excluded medication is approved, then it would be covered at a higher copay or coinsurance rate. The member would pay the lowest of the following, either the applicable copay, the contracted drug rate, or the pharmacy's usual and customary price. Changes are made to the prescription drug list twice a year, January and July 1st, except for Louisiana and Texas, that is only done January 1st. However, there could be some additional changes throughout the year due to new generic availability. Tier 1 drugs include many generic drugs, like the highest value, brand drugs, and some zero preventive medications. Tier 2 includes lower value generic drugs, high valued brand and specialty drugs. Tier 3 will provide a limited number of low value drugs, high cost specialty drugs, and Tier 4 includes the lowest value drugs and the highest cost specialty drugs. Once your clients have enrolled on a UnitedHealthcare off-exchange health plan, covered pharmacies and locations can be used by accessing myuh1.com. They can click on a provider in the toolbar at the top of the page and then select prescription drug. New members that are enrolling in or have enrolled in a 2016 plan beginning 1/1/16 and after will want to choose the option stating if your ID card is issued by UClick and your coverage is effective 1/1/2015 and after. So they want to make sure that they choose the right listing when they're on our website. Clients who choose the UnitedHealthcare on-exchange product can view their network providers, access the plan summary of benefits, and view the plan brochure from the plan management page during the quoting and enrolling process. on-exchange clients would access that information through the myuhc.com portal, where they, again, can access pharmacy information, prescription listing for the prescription drug list, find physicians, find a dentist. Your new clients and members can also access the myuhc.com. Kind of already said that, to access the dentist on the UHC Dental Network. The information is available on the homepage without requiring them to register or log in. Some of the value-added benefits when choosing the ACA plans from UnitedHealthcare for your on-exchange clients will have the myuhc.com online tool. Once your clients are enrolled in the on-exchange product, they can register at myuhc.com. Once registered, your client can take advantage of viewing benefits and eligibility, estimating treatment costs. They can actually chat with a nurse online, view claim documents, explanation of benefits, look up network providers. They can also enroll in online health and wellness programs, view account balances, and much, much more. So utilizing the myuhc.com tool for your on-exchange clients, your clients will get the most out of their health plan benefits. You'll also want to tell your clients about virtual visits for on-exchange. It'll allow them to access online care at any time. The virtual visit benefit allows your client to communicate with a doctor by using a mobile device or a computer instead of going to an in-office appointment. Doctors can diagnose and treat a wide range of non-emergency medical conditions. Most visits take approximately 15 minutes, and your client's doctor can write them a prescription if needed. Virtual visits are included in your client's coverage for on-exchange when, again, your doctor is not available, when they're traveling, or they may be considering an emergency room visit for non-emergency situations. Once your clients are enrolled in their 2016 plan, they can register for virtual visits at the myuhc.com member portal. Virtual visit benefits are specific to the client's plan that they have chosen. Benefits are available only when services are provided by a designated virtual network provider. Your client can locate a designated virtual provider by accessing the network listing at myuhc.com or by calling our customer care center at the number that is located on the back of their ID card. Again, for your on-exchange clients, they will have the Health for Me mobile app, which is designed to help members manage different aspects of their health, like searching for providers and getting healthcare cost estimates for specific treatments and procedures. Members can access their ID cards, claim information, real-time status on account balances, deductibles, and out-of-pocket spending. They can also find a physician or facility near them using a GPS location search feature. Access My Claims Manager, designed to help members manage healthcare claims and pay providers right from this app. They can also search for pharmacies, claims, drug pricing, and mail orders for prescriptions directly from this app. Now let's take a look at how your client pays his or her premium and how to effectuate their policy. For off-exchange, credit cards, bank draft, and payment by check or money order are all options for your clients to pay with their initial premium. Credit cards are not accepted for ongoing payments. However, your clients can set up the convenience of monthly bank draft option or EFT. When your client chooses the direct bill option, they will be sent a bill each billing period 2 weeks in advance of the premium due date. When your client applies for a plan from our off-exchange product portfolio, a minimum of 1 month's premium must accompany the application. Checks and/or money order payments are processed once received. However, credit card or EFT payments are not processed until the plan is issued. Once the plan is issued, ID cards and the plan policy certificate is mailed directly to the policyholder. And your client can also make changes to future payment methods from the myuh1.com member portal. For on-exchange, it is a little bit different. So on-exchange health plans, he or she can pay have the choice to pay the first month premium at time of application or be billed later. I would recommend that you don't do the bill me later function, because most people then will put off paying their health insurance premium and will delay their effective date. So I would try to get everybody to pay at time of enrollment. Payment is accepted by credit card for your clients to choose to pay at the time of enrollment. Your clients that choose the bill me later option can then pay his or her bill at the uhcexchangebilling.com website. They can pay by phone, or they can send in a personal check or money order. Ongoing premium payments can be paid either by credit card, EFT, pay by phone, or again, direct bill for those that want to pay by a personal check or money order. Once your client has completed his or her enrollment, then we will send them confirmation that their enrollment was received. When your client receives the member welcome letter, they will also receive a temporary ID card. Now this is, again, just for on-exchange. I wanted to point that out. The temporary ID card will have a sticker across the top. It looks like a credit card that will provide your clients instructions on how to effectuate his or her ACA plan. Regardless of the number of family members on the health plan, one temporary ID card will be mailed. Effectuating a health plan requires the client to contact either going through uhcexchangebilling.com or to call into our member service team at the phone number found on the back of their temporary ID card. Your client can activate his or her health plan in easy 2 or 3 steps by either starting with paying the premium. 1 month minimum premium is required, and then also provide his or her email. They may also have a step in there where they need to select their primary care physician if they haven't done that at time of enrollment. If your client does not have an email address, that's okay. However, he or she will need to be able to do more online, like paying the premium, and that would require that email address. Once your client has paid or effectuated his or her health plan, they have within 7 to 10 days, he or she will receive the health plan kit. The health plan kit will include a cover letter, the summary of benefits, and the health plan policy. They then will also receive their permanent ID card within a few days after the health plan kit. Broker registration, I'll actually just go through this real quick. For selling on exchange, most of you probably have already gone through the 2016 FFM requirements by going out to the CMS portal and completing the necessary tutorials to get your certification. We do not need your certification forms. We will be getting a download every 2 weeks from CMS, and we'll be updating our system. We just got our first download from CMS, so we're actively doing that right now and making sure everybody has that ready to go for 11/1. And if you haven't done it already, you can continue to do that, and we'll continue to get those reports from CMS to update our systems. Once you are certified on the FFM and appointed to sell the UnitedHealthcare individual plans, you'll have access to eStore. eStore will give you many resources to help make your job easier. If your client does not qualify for a tax credit and you'll be enrolling off exchange, you will quote plans from the ACA Plans Not Tax Credit Eligible section. If you would like to provide a selection of plans, remember you can quote up to 4 different health plans for your clients to review. Once you've selected plans, choose View Plans at the bottom of the screen for a side-by-side comparison of the chosen plans. To begin the enrollment process with your client, you can start the Start Broker Assisted app. The prospect information screen will appear as normal because we are now post-open enrollment. The screens will look a little bit different. The screen will go away because they won't have a qualified event as of November 1st. It'll be now a new open enrollment period. If your client experienced a qualified event, then they will have some other screens here to choose from. If your client is not covered by Medicare, then choose no. Applicants covered by Medicare are not eligible for an ACA plan. The next page verifies your client's tobacco use and whether all individuals on the application are U.S. citizens. Once you've answered those, choose Save and Continue to move to the next page on the online application. When your client is applying for the off-exchange plan with the Navigate network, they will choose a PCP for each family member. And I'm sorry, this actually is not correct because for off-exchange, we use the Choice Plus, and they don't have to choose a primary care physician, so I apologize for that. They will not get this screen. Next, you will enter in the payment information. Once you complete that, Save and Continue will give you the cart checkout page. It'll simply give you the summary of the plan that you selected and also give you some additional plans to choose from on the ancillary side, like short-term, dental, critical illness. Once you've assisted your client with the cart checkout screen, then select the Send to Prospect button. Once your client has reviewed the application for accuracy, he or she then will continue to enter the Social Security numbers for each enrollee included on the application. Once your client electronically signs the application, he or she will receive notification via email that that application was received, and it will also then give the application number. And if your client missed the opportunity to add additional coverages, there will be additional buttons on the bottom of the page to assist your client in looking at some of those coverages. The on-exchange quoting and enrollment is a little bit different, and we'll look at that process right now. Once again, you will use eStore to quote, and you'll select the instant quote option and entering in their zip code of where that client resides. You will select the plans from the tax credit eligible section. You will then select the plan that they want and select the Start Broker Assisted app from that column. So the prospect information screen will appear, just like it did for off exchange, by putting in first and last name of the client and their email. This is where you're going to see a difference in the two processes. You'll be assisting your clients to enroll by completing the process on their behalf for on exchange. So these screens will highlight the chosen plan to the left of the screen. Before you start, we'll give you some information to help with the enrollment process. Next, you will read and agree to the privacy terms to start your client's enrollment. You will then complete the enrollment process for your client. At the top of the page, through the on-exchange enrollment, you'll notice the status bar. This will keep you aware of where you are in the enrollment process. So there'll be different pages for household information, address, background, income, and the last page will be the confirmation of information page. So this way you can already start quoting and seeing these plans on eStore for 2016, but you won't be able to start applying until November 1st, so you could start quoting now. With the single site enrollment process that we have now, like I said, you can actually walk through the entire on-exchange application with your client. So once you do select that plan, you want to make sure that you have some information readily available for you to complete that entire application, like Social Security number, proof of residence, income information, and any prior policy information. And keep in mind, for 2016, for the no coverage penalty, for 2016 is greater of 2.5% of your client's income, or $695 per adult, and $347.50 per child. The penalty applies per month once your client has been uninsured for 3 months. And I apologize, we had some screens missing here again for our single site enrollment. I'm just going to go back to that page real quick here, if I can. Well, I can't. So for On Exchange, it is that simple process of actually walking through and answering all those questions and then paying up front for that application to get their temporary ID card and get everything rolling. So that single site will actually work much better for you this year and not going to healthcare.gov. So keep in mind, if you do have a client that you know they're going to go with United Healthcare, it might be best to go through our system. It should take less than 15 minutes to get through an application through our system versus going to healthcare.gov. Now that we reviewed the plans, we'll look at some of the additional opportunities for you and tools that we have online on your broker portal. You'll have the 2016 plan brochures for each state-specific state that you are licensed with us and non-resident states. You'll also have some advertising materials that you will find a broad selection here that you can actually put in your contact information and either place for distribution or in a newspaper. We'll also have additional marketing materials for On Exchange online as well. We've also updated eStore to give you more information on healthcare reform. So we'll continually update this as changes are made throughout the year. So it'll give you some tools to learn more about the changes on and off exchange. Also, in your producer guides that we'll have for us, you will have contact numbers for both on and off exchange. And again, in your plan brochures, it'll also list state plan availability and the different resources that we have and contact numbers. So pulling it all together, in 2016, United Healthcare is anticipating increasing the areas of on-exchange plan availability to 35 states and up to 28 states where you can find off-exchange products. Additional network options have been added to many states and counties, which gives your clients choices when selecting the plan that fits their family's needs and budget. This year, your clients can apply for the UHC on-exchange health plan cost share reduction plans right from eStore. You'll also have many benefits for using the eStore and the enhancements that we've made it easier for that online enrollment process. And also the many value-added benefits and online tools are included in the plans to bring convenience and cost savings to your clients. So with that, I thank you for your time today. My contact information is listed there as well, and if there are additional questions, you can definitely get that through KHI.
Great. Well, Melody, thank you. That's a lot of information. Now, we will have a copy of these slides, correct?
Yes, Melody? We'll get those to you. Mm-hmm.
Okay, so and then we'll put this, you guys, the recording and the slides out on our website, and depending on how quickly we can do that, hopefully, certainly by, I would say by the end of business tomorrow, we could have that done. So we do have a question, and this comes from Renee, and it says, could you explain freestanding labs? Does it include doctor's office? And what about rural areas where there may not be any? Are there any exceptions? That's a lot of questions, but we're going to see what you can take there.
Sure. A lot of the freestanding facilities are like MRI facilities. It's not a true hospital or a clinic. So some cities do have those freestanding facilities that will get a better benefit for using those. If they don't have it in their area and they have to go to the hospital, it will be paid at a lower benefit.
Okay, and then I think the other question, what about rural areas, and there may not be any of those, are there any exceptions? It sounds like not, but I do know in Des Moines that, for example, I needed an MRI done, and there is a place in Des Moines, I'm thinking if it was Iowa Radiology, but there's places around that will do, for example, an MRI and charge you an office visit. They're a freestanding, like you said, facility, so sometimes you just need to call around for those.
And we'll also have them listed on our network site that'll show those facilities, so they can always do a search in their area to see if there are those freestanding facilities.
Great. Looks like another question came in from Sherry. What about Mayo Clinic?
Mayo Clinic is not in our network. It may be on the group side, but it is not on our individual side at all. Just with negotiations, it would bring our rates up even higher, and we don't feel that would, yes, everybody wants Mayo, not everybody, but it's unfortunately not that we're looking for that in any near future to have that in our network.
Okay, appreciate that clarity. And then a question here from, and Sherry says, thank you for sharing, great information, good deal. And then Michelle says, so we have a local clinic that's connected to the hospital and they use their facilities. So we need to tell the client to go to Omaha or Council Bluffs for the MRI or CT scans?
Well, we would, as far as that, we would want to make sure and check to see if that clinic is in the network.
Right. So I think what I'm hearing her say, though, if there's a clinic that's connected to a hospital and they use the hospital facilities, then generally you're going to have, you're not going to have a copay, right? I mean, that would be, you're going to have a hospital charge just because
Correct.
They're connected to the clinic. You're going to have a hospital charge. I think a lot of those freestanding places this is like all they do are MRIs.
Correct.
And so maybe, Michelle, to answer your question, it says we need to tell the client to go to Omaha or Council Bluffs. So if that's their closest area where they might find a freestanding MRI or facility that would conduct an MRI or a CT scan, then the answer is yes, right?
Correct.
Right, Melody? Yeah. It's crazy, and I think that's where we as agents come in to be helpful so we can help our clients navigate. I would pull up in your local areas to know where are your local freestanding facilities that do these kinds of things. Because I know several of us have talked about the ones in Des Moines, but if you're closer to Omaha or Council Bluffs, find out where those are. And it's amazing. I remember because an MRI we know is really expensive, and I got it for like a $20 office visit copay several years ago. And it was like, wow, okay, that's a good place to go to get that and not have to meet my deductible and pay co-insurance. So,
correct.
Let's see, another question here from Larry. Do you offer a monthly direct bill? That's the first question. Is there a monthly direct bill?
Yes. For both on and off exchange, there is monthly direct bill.
Okay, and then his second question is there a paper application if we can't access maybe online?
Only for off exchange will there be a paper application available.
Okay, off exchange only, and we'll make sure we get this stuff and then we put it out on our KHI agent website so it's easily accessible for you guys. So, okay, that makes sense. On exchange must be on online, and off exchange could be done on paper or online.
Correct.
Okay. All right.
Yeah. One thing I just want to add,
please.
actually, for the on exchange clients with them getting that temporary ID card, again, it's really educating your client as to what they're going to get from us. So, tell your clients that you're working with on exchange to say, if at time of application they don't pay or they don't pick their primary care physician, make sure you educate them, okay, you're going to get something in the mail that has a temporary ID card and a phone number. In order for your plan to go active, you need to take those steps to effectuate to pay. That is the key, is making sure they pay. They don't have to select their PCP. If they don't, what will happen is when that first claim comes in, that's who we're going to assign their primary care physician if it's in network. But if they do see a primary care physician, I would recommend that they do that up front as well. So again, it's just really educating your client as to on exchange what they're going to receive, and their policy is not going to go into effect until those steps are done.
Yep, that makes sense. Okay. Any other questions? This was great information, and I think that's why it's helpful. We wanted to record this so you can go back and re-listen to certain parts or look through the slides, because I think that process of us setting the expectation for the client is so critical. You bet.
Perfect. Well, I definitely thank you for the time, and everybody that was on the line today, and looking forward to working with every one of you into open enrollment.
Okay, sounds good. And listen, we encourage you guys, call us. We're here to support you, and Melody is our support. So even though she's got her contact information up there, I would encourage you to call KHI. So we'll help you, and then we'll get to Melody if we need to get something escalated. So great. So Melody, thanks for your time today. Agents, thanks so much for joining us, and we'll look forward to talking to you all again real soon. Take care. Bye-bye.